Good afternoon and welcome to the Alliance for Home Health Quality and Innovations webinar on the Home Health Chartbook, Updated Data and Trends for Home Health Care in the United States. My name is Teresa Lee and I'm the Executive Director of the Alliance. By way of background, the Alliance was founded in 2008 and is dedicated to the mission of leading and fostering research and education on the value home health care has to offer to patients in the entire U.S. healthcare system. Our webinar today will focus on the compendium of data that the Alliance commissions on home health care in the United States. The Home Health Chartbook was commissioned by the Alliance from Avalere Health, LLC, a healthcare consultancy that works with healthcare stakeholders to improve care delivery through better data, insights, and strategies. We're fortunate today to have as our guest speakers Ellen Lukens and Sally Rodriguez of Avalere Health. Ellen Lukens is a Vice President at Avalere Health and provides strategic support to a broad array of clients interested in better navigating the current and future hospital and post-acute care delivery and payment environments. She has expertise in assisting clients who are working to transform the way healthcare is delivered and also has led strategic planning engagements with clients. Prior to joining Avalere, Ellen worked at the National Association of Public Hospitals and the Greater New York Hospital Association. And earlier in her career, she was a policy analyst in the Centers for Medicare and Medicaid Services. Ellen has a BA from Northwestern University and an MPH from the University of Michigan. Sally Rodriguez is a senior manager at Avalere Health who provides analytic and strategic support to clients in the post-acute and long-term care sectors by using data analysis and policy expertise to help them navigate the healthcare market. Prior to joining Avalere, Sally worked as an analyst for the Government Accountability Office. Prior to GAO, she fielded and analyzed HEDIS CAHPS surveys for the Center for the Study of Services. Sally has a BS in Health Promotion Disease Prevention Studies from the University of Southern California and a master's in public health with a concentration in policy from George Washington University. We're very fortunate to have them both. Before we get started, I just have a few housekeeping notes. First, Ellen and Sally will speak for approximately 40 minutes and we'll leave the last 15 minutes to answer questions. Please note that this is a webinar and we control the slides on our end, so don't be surprised if you're not able to flip ahead. Second, your lines should be on mute. You can submit questions to be answered during the Q&A period through the Fuse webinar software on your computers or other devices. You can send a question to be answered in the Q&A period by sending a question to me, Teresa Lee. Finally, we will be posting the slides on this webinar from the webinar after this webinar is over, and we will also be recording it, and we'll be posting the playback on the Alliance's website. Without further ado, I'm going to turn this over to Ellen and Sally.
Thank you, Teresa. This is Ellen Lukens from Avalere Health's Post-Acute and Long-Term Care Practice. Thank you, everyone, for joining the call today. I'm joined by my colleague, Sally Rodriguez, who's led most of this research. She and I are going to share the research with you, and then, as Teresa said, then we're going to open up the line for questions. As you'll see, this is a very comprehensive data effort, so we're not actually going to walk through every slide. But if you have any questions following the presentation after you look at the complete chart book, please feel free to reach out to Teresa, Sally, or me, and our contact information is included at the end of the chart book. So we will start today with Section 1, which provides a national overview. And the purpose of this section is really to provide the context for the later sections, which focus more specifically on home health. Slide 4 shows that for all Medicare patients that have an inpatient hospital stay, it shows in this graphic where they go upon discharge. So you'll see that in 2011, 37% of all Medicare beneficiaries got some form of post-acute or post-hospital care. 56% went home to the community with no home health, 3% died, and 3% received care in some non-post-acute care setting. Of the 37% who do get formal post-acute care, 37%, or 1.4 million beneficiaries, received home health services. This post-hospital care for 1.4 million patients demonstrates home health's important role as a post-hospital partner, helping Medicare patients transition from an acute care hospital stay to their home. The remainder of this initial section focuses on the prevalence of chronic conditions. Slide 5, which is chart 1.2, shows the percentage of Medicare beneficiaries aged 65 or older by number of chronic conditions. What these data show is that more than half of Medicare beneficiaries have 1 to 3 chronic conditions. Very few, only 6.2% have none, but 30% have 4 or more. And as you probably know from other research, chronic conditions are one factor that drives Medicare spending. Slide 6 shows the percentage of Medicare beneficiaries by chronic condition. As you see, hypertension is the most common chronic condition among Medicare beneficiaries, affecting over 68% of beneficiaries, followed by arthritis that affects 56%. The slide 7, which is chart 1.3, shows the number of beneficiaries also affected by each condition. The next section, section 2, is where we're going to really start focusing more on home health users rather than the entire Medicare population. This section provides an overview of the demographics of the home health population, that's the Medicare home health users, versus all Medicare beneficiaries compares them on different characteristics, such as age, race, ethnicity, gender, dual eligible status, and income. So we'll start with slide 9. Slide 9 shows the age distribution of home health users versus all Medicare beneficiaries. As you see, folks that use home health within the Medicare benefit are disproportionately older. 35% of home health users are between ages 75 and 84 versus 27.7% for all Medicare. Almost a quarter of home health users, 24.2%, are over age 85. So you can see that a lot of home health users are the oldest old. And that compares versus 12.4% for all Medicare beneficiaries. Slide 14. We will not walk through all the slides. As you saw, we just skipped a few, but I did want to draw your attention to slide 14, which provides a summary of several demographic characteristics of home health users versus all Medicare beneficiaries. As you see, home health users are more likely to be older, live alone, have 3 or more chronic conditions, 2 or more activities of daily living limitations, and report fair or poor health and have lower income. So I think the slide's now on the webinar, so I just want to repeat that just so you could, because it's really a summary slide. And it's a summary of several of the demographic characteristics that I think are really important. So if you look, home health users are more likely to be older. You see that in the over age 85. Live alone. You see the percentages there. Have 3 or more chronic conditions. And there you see the 83.2 versus the 60.5. 2 or more activities of daily living limitations and report fair or poor health and have lower income. So in terms of how we're measuring the income, I just wanted to give you for point of reference, we show you folks who have incomes under 200% of the federal poverty level and then under 100% of the federal poverty level. For reference, 100% of the federal poverty level for a single person is $11,490 per year. The rest of the portion of the section that we'll be focusing on focuses on the race and ethnicity of Medicare home health users. So now we will turn to slide 17. And again, we're not going through every slide in this section. Slide 17 is actually another summary slide. So what you see preceding that, if you want to go through them on your own, are the demographic characteristics, and those are graphically depicted. So slide 17, which is another summary slide, I'll give the, I know you don't see it on your screen right now, but it will come up. It's a summary. There we go. It's a summary slide that shows that home health users are more likely to be Black or Hispanic. In addition, these Black and Hispanic home health users tend to have lower incomes and more chronic conditions relative to the overall Medicare population. So you can see that here, if you look at the third row, which is 3 or more chronic conditions, you can see a substantial difference between the Black Medicare home health users, the Hispanic Medicare home health users, and then all Medicare beneficiaries. Similar trends apply to ADL limitations, reporting fair or poor health, and also low income metrics, 200% of the federal poverty level and 100% of the federal poverty level. We'll now turn to slide 22, and that shows the dual eligible status of home health users versus all Medicare beneficiaries. As you will see, and I think this is really interesting, for the under age 65 population, home health users are much more likely to be dual eligible. But for the over age 65 population, home health users are less likely to be dual eligible beneficiaries than the overall Medicare population. The final portion of this section gives an overview of the proportion of home health users that have severe mental illness versus the overall Medicare population. As you will see on slide 27, 26.3% of the home health population has a severe mental illness versus 16.6% for the overall Medicare population. So as you saw in these demographic overview slides, there are substantial differences between home health users versus non-users in the Medicare population on several different demographic parameters. And as Teresa said, after the webinar, you will have access to the full chart book where you can look through each of those slides that graphically depicts some of those differences. We will now turn to section 3, which gives an overview of the clinical profile of home health users. On slide 30, you will see the most common hospital MSDRGs for beneficiaries who are subsequently treated for post-hospital care by home health agencies. Avalere reviewed a 100% sample of all beneficiaries with a hospital admission in 2011 and linked those claims with home health claims to see who received home health services following the hospital admission. For those beneficiaries that did have home health services following the hospital admission, we looked back to see what the hospital diagnosis was. As you will see in this table, the most common diagnosis, or MSDRG, is major joint replacement or reattachment of lower extremity without major complications or comorbidities. And that represents over 10% of all hospital cases referred to home health. As you know, this condition is also treated in other settings, such as skilled nursing facilities and inpatient rehabilitation facilities. In this context, home health is the lowest cost provider for this service. There are a total of 751 MSDRGs, so you'll see that the concentration in one is substantial. You have over 10% in one. And then if you look down at the bottom there, after you see the top 20, you'll see that 37.5% of home health cases are concentrated in the top 20. So there's a fair level of concentration in those top 20 MSDRGs. Again, those are the conditions for which the beneficiary was treated in the acute care hospital. Slide 30, the one we were just looking at, shows the condition for which the beneficiary was hospitalized. The next slide shows the prevalence of chronic conditions among home health users. These data show the diagnoses included on home health claims. If you look here, the most common diagnosis is diabetes. 9.7% of home health claims include a diagnosis of diabetes. Next slide. The next slide shows the prevalence of multiple chronic conditions among home health users. Avalere analyzed the Medicare claims to identify those beneficiaries that had 3 or more chronic conditions and used home health within the year 2011. We then compared these beneficiaries against the Medicare population that did not use home health. As you see, home health users are substantially more likely to have 3 or more chronic conditions than all Medicare beneficiaries. The prevalence of 3 or more chronic conditions varies by state from around 80 to 90%, but in all states, the prevalence is much higher than for all Medicare beneficiaries, where the prevalence ranges from about 12% to 41%. So something that we thought was really interesting about this is you see the vast majority of Medicare home health users have 3 or more chronic conditions, and there's not that much variation among states. But if you look actually at states where the prevalence of 3 or more chronic conditions among Medicare beneficiaries who are not using home health, there's actually a fair amount of variability. So it varies all the way from 12%, which I think was Hawaii, to 41%. And again, we are happy to answer questions about this when we're done walking through all of the slides. So the next section, section 4, talks about the home health care services industry workforce. And this really shifts the focus from the beneficiary or the user of home health services to the home health care workers. On slide 34, I think the slide numbers are, it might be slide 38, we show the number of home health care aides. These data are from the U.S. Department of Commerce, the Bureau of Labor Statistics. If you look here, actually, you see that the number of aides actually decreased slightly between 2011 and 2012. The next slide shows that the Bureau of Labor Statistics is anticipating large increases in demand for aides. They're anticipating an over 90% increase in the number of aides from 2010 to 2020. This may not be that surprising to you because it's largely driven by demographic projections, the aging of the baby boomers, and the anticipated corresponding increase in demand for home health care services. Slide 36 provides a little bit more information about home health care workers, specifically their gender. And as you see, home health care workers are overwhelmingly female. Over 87.6% of home health workers are women, according to the Bureau of Labor Statistics. With that, I'll turn it over to my colleague, Sally Rodriguez, who will walk you through the remainder of the chart book.
Thanks, Ellen. Section 5. So this section provides data regarding the organizational trends occurring within the home health industry. Next slide, please. As this slide shows, the number of home health agencies has been steadily growing since 1994. There are now 9,855 home health agencies as of 2011, based on Medicare cost report data, and about 9% of those also offer private duty nursing services. The next slide shows the breakdown of agencies based on the number of employees collected by the Census Bureau. Nearly 40% of firms were very small, with 4 or fewer employees, and more than a quarter of agencies employed between 20 and 99 people. And the next slide shows that in terms of total revenue, most agencies fell in the middle of the spectrum, with over 40% collecting between $500,000 and $2.5 million in revenue in 2011, based on Census Bureau data. The next chart breaks down agencies by revenue and by the percentage who operate in health professional shortage areas. Unsurprisingly, the agencies generating the most revenue were less likely to be operating in the HPSA areas. On the next slide, we show agencies again by revenue and also by the percentage that are operating in counties that are considered majority minority, or in other words, counties that have a majority of residents who belong to racial and ethnic minority groups. For the most part, the data show that smaller home health agencies are more likely to be operating in these counties. Next slide. So the next 5 slides in the chart book show data from the Medicare Standard Analytic File, or the claims data. Both Part A and Part B home episodes grew steadily between 2006 and 2011. However, Part A episodes remained stable from 2010 to 2011, and you see that there's a little bit more growth within the Part B episodes. Next slide. Whereas the last slide showed the number of episodes, this slide shows the number of Medicare beneficiaries that had a home health episode. In keeping with the prior slide, this number also grew between 2006 and 2011, but more and more beneficiaries had Part B episodes, where Part A again remained stable. Next slide, please. This slide shows the number of beneficiaries with a home health episode by state for 2011. So again, we're trying to provide data not only on a national level, but on a state level, and that's something that you'll see throughout the chart book. On the next slide, we look at the number of home health episodes per beneficiary that used home health between 2006 and 2011. So Part A episodes, again, remain stable at just under 1.5 per beneficiary using home health. But the Part B episodes grew before tapering off to around 2 episodes between 2009 and 2011. On the next slide, we show that in terms of number of visits per a 60-day home health episode, the number reached a peak in 2011 and tapered off for both Part A and Part B episodes in subsequent years. The decline is more pronounced among Part B episodes in recent years. The next section utilizes several data sources as well as multipliers from the Bureau of Economic Analysis to estimate the economic contribution of the home health industry. In the next slide, we show the economic contribution related to home health jobs in each state. The economic multipliers, which you can see here in the middle column of data, they attempt to quantify the additional jobs that are created based on the ripple effects of expenditures and demand produced by home health employees. And again, we show these data by state. The next slide is a similar slide, but in this slide, we're estimating the indirect impact of wages rather than number of jobs, of wages paid to home health employees on the impact on total labor income in each state. For example, in California, each dollar paid to a home health worker generates 65 additional cents in terms of total labor income, as that employee spends his or her wages on goods and services that contribute to other labor income. The next slide estimates the economic impact of home health expenditures on total economic output in the states. So this is taking into account additional jobs, wages, and other economic effects generated by the home health industry. The next section, Section 7, focuses on outcomes related to home health users. The next slide, which we calculated using Medicare claims data, shows the 30-day rehospitalization rates for patients with a variety of diagnosis codes, or DRGs. We show, for comparison purposes, the rehospitalization rates for similar patients who first went from the hospital to a skilled nursing facility and patients who went from the hospital to their homes with home health services. So we show both of those for comparison purposes. For the most part, rehospitalization rates for SNF patients were slightly higher than those who received home health care. But it is also important to note that these data are not risk adjusted beyond the adjustments that are included in DRG coding groups. In the next slide, actually the next two slides show data from the Medicare Home Health Compare website. This first slide, if you back up, there you go. This first slide shows the national averages for home health agency performance on certain process measures or measures that assess whether the home health care team performed certain key actions. On average, home health agencies scored very highly on these measures. The next slide focuses on the outcome-related data from Home Health Compare which gauge whether home health users face certain outcomes during the course of their home health care. On average, a slight majority of patients did show improved functioning, though an average of 17% also had to be admitted to the hospital during their home health episode. And all of these data are found within the Home Health Compare website on CMS's webpage. The next section is national trends, and again, we're just trying to provide some broader context. So these are national healthcare trends that are not specific to home health users or home health agencies. This next slide shows the increase in total healthcare expenditures nationally between 1980 and 2011 in billions of dollars. The next slide shows the same healthcare expenditures as a percentage of GDP during the same time period. And this indicator, just like the previous, is on the rise. The next slide, not surprisingly, healthcare expenditures are projected to continue growing between 2011 and 2021, hitting nearly $5 billion in 2021. The next slide focuses on Medicare enrollees, and that number has also been steadily increasing since 1980, keeping pace with overall population growth. The next slide, as we all know, the number of Medicare enrollees is projected to continue to increase as the baby boomers age, hitting over 65 million enrollees in 2021. On the next slide, we look at another increasing trend, which is in the percentage of Medicare enrollees who are enrolled in a Medicare Advantage or private plan. Though Medicare Advantage enrollment as a percentage of total decreased from 1999 to 2005, it has been increasing steadily ever since, and we expect that number to remain the same or increase in the near term, despite cuts to these plans contained within the Affordable Care Act. On the next slide, we're showing the increase in Medicare post-acute care expenditures between 2001 and 2011. Post-acute care spending has increased significantly over that time period, which contributes to the increased scrutiny that post-acute care providers face from MedPAC and the policymakers. The next section, I just wanted to pull a couple of examples of the state-specific data that is contained in the full chart book. I selected 3 states to illustrate the data that we've created here. We are showing the prevalence of chronic conditions for both the total Medicare population in the state and the home health user population in that state. In the case of every state, these data show that home health users are considerably sicker than the average Medicare beneficiary. And in many states, a majority of home health users have 5 or more chronic conditions. If you look at this slide with Oregon, Oregon is a fairly typical example. But if you flip to the next slide with Nevada, you see that Nevada has a relatively healthy Medicare and home health user population. But then when you flip to the next slide, which I chose Maine, they have a relatively sicker Medicare and home health population. So those are just 3 of the state-specific slides that are contained within the full chart book. The next slide is we have a couple of appendices within the chart book just to give some detail on our methodology. So this slide shows the methodology that we used to calculate the rehospitalization rates that were back on slide 53. And I don't want to spend much time on this, but what I did want to mention is that to the extent possible, we followed the CMS methodology for rehospitalizations that is used within the hospital penalty program. Next slide. So the second appendix contains the results of an analysis conducted by Dobson DeVonzo. As we did not contribute to this work, we will not be speaking to it, but again, you should feel free to contact Teresa Lee or the other AAHQI staff for more information about this work. So next slide. Last, please. So that concludes our presentation of the Home Health Chartbook. I'm going to pass it back to Ellen really briefly. But as we said in the beginning, if you have any questions or would like to discuss Avalere's data capabilities or the methodologies that we use, please feel free to contact Ellen or myself. Our contact information is on this slide. And Ellen?
Hi, everyone. Since we have a little bit of extra time, we are going to go back to the demographics section and just highlight a few additional slides that we had as extra if there was time allowing. So I'm going to focus on the chart number instead of the page number. So it's chart 2.1 is where it starts. And it's where we're focused on the age distribution of home health users and all Medicare beneficiaries. So specifically, the section that Sally and I wanted to highlight if we had additional time was related to home health users versus all Medicare beneficiaries, and then home health users versus users of skilled nursing facility services. So I think we spoke to this one before about how home health users are disproportionately older. I did want to show you chart 2.2. That's the next slide. And that shows how home health users are more likely to be women, which I think we showed you on the summary slide, but this really reinforces it with the graphic. You can see that 60.2% of home health users are female versus all Medicare beneficiaries, where it's only 55%. The next slide, slide 2.3, gives you even more of a sense of who this population is. What we think is really interesting about this is if you look at the percentage of home health users versus all Medicare beneficiaries that are separated, divorced, or never married, it's actually very similar. The difference is between the percentages that are still married versus those that are widowed. So if you see for all Medicare beneficiaries, 51% are married, whereas the home health users are much more likely to be widowed. You see only 37% are married and 39.6% are widowed. Next slide. So this is the part that we wanted to really highlight with the additional time we have right now, which is we compared all Medicare beneficiaries, skilled nursing facility users, and then home health users. And we looked at the rates of home health users, skilled nursing facility users, and all Medicare beneficiaries in 2011. And what we found is that home health users, as we suggested in the summary slides, but I think this spells it out even in a more sort of interesting and graphic way, that home health users are more likely to be Black than white users, and other contains all those categories that were too small actually to group independently. But you see for the white beneficiaries, you have the skilled nursing facility users actually more likely to be white than all Medicare beneficiaries. So you see that there are some differences in patterns of utilization among different races and ethnicities. And this one also suggests that there are, the next slide please, slide 2.5. Next slide. The next slide shows the income distribution of home health users, skilled nursing facility users, and all Medicare beneficiaries. And again, we thought this was interesting because it shows that there not only are racial and ethnic differences between folks using different types of post-acute care, but that there are also income differences. So if you look at beneficiaries with under 25% per year in income, you see that 49.5% of all Medicare beneficiaries have that income. You see that home health users are more likely to have lower income than all Medicare beneficiaries and also than skilled nursing facility users. But you actually see that home health users and skilled nursing facility users in general, those using post-acute care, have lower incomes relative to all Medicare beneficiaries. If you look at, obviously, the folks on the right, 25% per year or more, there you see that all Medicare beneficiaries, over 50% have 25% per year or more in income versus the other two groups. And again, the home health group there is the lowest income. So those are just a few additional slides we wanted to highlight with the time. And now we will turn it over to Teresa for questions.
Great. Thank you both for a terrific presentation. We do have a few questions, and the first question comes from Cheryl Leslie. she asks, does sequential billing shift A to B explain the growth in Part B? So, I mean, I guess what she might be referring to is the fact that after a patient gets discharged from the hospital, they start out as a Part A episode, but then subsequently, if there are subsequent episodes, sometimes there's a shift to becoming a Part B episode. So anyway, if you can talk to that, what trends you think might be driving the split between the Part A and the Part B episode trending.
We actually didn't disaggregate the Part B among longer users versus community admits. So I think it's an interesting question. What's driving the Part B users? And the growth is definitely in Part B, so she's absolutely right. The answer is not that it's not that there's a shift occurring within. It's that Part B is growing really quickly and Part A is not.
Yeah, I mean, I think we're not entirely sure within the data. It's not always clear whether the person is continuing a Part A episode or whether they are just starting a new episode from the community. So, that would be a really interesting question to look into the data to try and solve. But I think, the growth in Part B episodes are sort of contributing to some of the scrutiny on Part B and, contributing to some of the momentum for things like a potential co-payment on those episodes to try and discourage some of that growth.
Mm-hmm. Yeah, I mean, I think that you're right. I mean, that would be an interesting additional question for us to ask, sort of what percentage of the Part B episodes were previously, were the previous episodes actually Part A episodes? Do you know what I mean? Like, how many of them converted from Part A because of different circumstances that relate to those specific patients? And I don't know. I mean, that would be an interesting thing to look at, and I think, really good question from Cheryl. So thank you. We have a question also from Warren Aber. He asks, have you captured any data related to availability of family caregivers? One study for heart failure patients showed a lower rate of readmission to short-term acute care hospitals if there was a companion at home.
We did not include any data like that in this chart book, obviously, but I do think that that's something that's possible with some of the data sources that we worked with. The Medicare Current Beneficiary Survey, they do try to collect some information on social support. So that's something that we could, look into maybe the next round of chart book data. I think what we did try to show was, sort of that household composition slide that Ellen spoke to about, folks that are widowed versus married, et cetera. And, it's sort of unsurprising that a lot of home health users don't have that live-in support, in the form of a spouse. But, yeah, I think it would be an interesting further research question to look at, other relatives or other support that they may or may not have.
Very good. Okay, one more question here. Sorry. Okay, we got a question about showing a link to the copy of the slides. We'll put that into the window. One more question here from Cheryl. How will the Alliance and Avalere use this study with HHS and CMS? Oh, that's a really good question. Something to date, I think that actually what we've done is drawn from the Chartbook data and shared this data in the context of our comments to CMS and to HHS in various different ways. So, for example, the Alliance has used a lot of this data in our comments on the home health PPS proposed rule, and we're constantly sort of drawing from it in various different comment opportunities, because we do find that it's really useful data to share, particularly on explaining exactly who policies related to home health affect. So to the extent that what's being proposed are cuts to payment rates, it's really important to be able to show, okay, that's fine. So you want to cut the payment rates? Well, these are the specific home health patients that you're affecting. These are patients who have higher percentages of chronic conditions compared to the general Medicare population. They're older, they're sicker, you're disproportionately affecting African American and Hispanic populations when you affect home health payment policy. So those are all issues that we've brought up in the context of comments, and I think that we'll continue to use the data in this fashion. I'll note too that we're also in the process of developing state-by-state one-pagers, because we have increasingly more and more data that is state-by-state in the chart book. What we're trying to do is pull that data out so that each of you in your specific states can use it with both your federal and state policymakers and legislators in order to what the demographic profile is and what the economic contribution is of home health agencies and home health patients. So let me go to the next question. This comes from Martha Williams. Martha says, there is a disproportionate number of chronically ill patients in the home health community. How do we, as a community, compare to other sectors in post-acute care on the basis of chronic and comorbidities? Sally, Ellen, what do you think? Are you there? I think that they might have accidentally dropped off. I think that that's an excellent question, and definitely one that we might want to look at in the future. We have a couple of slides, as you guys know, in the chart book that did compare home health patients to SNF patients to the general Medicare population. I do think that there have been some, there may be some other areas we can do similar comparisons and maybe get at the answer to that question. But I think it's certainly a legitimate question, and one that we could maybe explore in future updates to the chart book. Any other questions? If you have any other questions, you can include them in the in-meeting chat box, which is accessible through the Fuse webinar software. And I think that the other thing to just note, as I think that we already mentioned, the chart book slides are all available on the Alliance's public portion of the website. So if you go to the Alliance's website, there's a bar across the top. If you click on Research and Data, there's a drop-down, and then under that drop-down, you'll see Home Health Chartbook. And if you go in, that's where you'll find the actual full set of the chart book slides. We're also going to be posting the playback of this webinar on that page so that anybody who would like to listen in again to this recording or would like to share it with others in their organizations or elsewhere, there will be a link to it so that you guys will be able to take full advantage of the data. I want to thank everybody on this call. I don't see any further comments or questions at this point, but I want to thank our speakers, Ellen Lukens and Sally Rodriguez from Avalere Health, for doing a fine job of presenting the data in the chart book today. As all of you think about the critical policy issues affecting home health providers and home health patients in this country, I would welcome your input on what additional data is needed in order to advance the value proposition that home health presents to patients and to the entire healthcare system. We're strong believers here at the Alliance in making sure that we have the right evidence base as we talk about the value proposition. And so to the extent that you think that there's additional data that could be provided or a different way to frame the data that's provided, I would welcome that input. Sally, Ellen, do you guys have any final comments?
Yeah, just that I thought that last question was really interesting, is, the multiple chronic conditions among home health care users. We did not necessarily compare them against other settings of care, but we did compare them against all Medicare beneficiaries, and they are absolutely, higher. And I think it's a really interesting question, is how does that setting compare to other settings like skilled nursing facilities and, other folks who are getting post-acute care, maybe in settings that are more expensive than home health agencies. So that's certainly something that we can look into.
Terrific.
Yeah,
Terrific.
and one thing that I would just follow that up with is that, we often look at chronic conditions and functional impairment in tandem. So, limitations of activities of daily living, and it's also interesting when we look, when we compare SNF and home health users, that there's actually a lot of similarity there too. I think, some people might intuitively think that a nursing facility user might have more issues with activities of daily living, but we do see that within the home health user population as well.
Great, very interesting. I thought that was a great question. We'll have to think about what further data we might be able to pull into the chart book in the future that relates to different settings, because I do think that increasingly as we look across the healthcare system for healthcare delivery system improvement, it's critical that we look across settings. Terrific. Thank you both so much for speaking today. This was great. And as I mentioned, a playback and the full slide deck is going to be available on the Alliance website. I want to thank all of you participating today. And if you have questions, please do reach out to either me, Sally, or Ellen. Again, we appreciate any further feedback for future iterations of the chart book in addition to further questions about what you've seen today. So thanks, everybody, and have a great afternoon.